Hi, everybody. Good morning. I am continuing on my live, my plan to go live every day for the month of January. And this week, the topic is 4 steps to feeling better. I have 4 steps for it and then a little wrap up on Friday. So today, before I get started, I want to remind you guys, I am doing a live masterclass tomorrow, Tuesday, January 11th at 1 p.m. Pacific, so 4 p.m. Eastern. It's going to be about an hour, maybe a little bit longer than an hour. I made an event and put it in as an hour 15 just to give some wiggle room, but it'll probably be about an hour or so. And it's why you're in pain, what's getting in your way, and what to do about it. So I'm going to walk step by step why what you're doing isn't helping alleviate or give you some relief from your pain, some things that are getting in your way, and then what to do about it. Give you a few steps of things to do right now to start feeling better. And with it, at the end of the call, at the end of the class, I invite you, if you want to hop on a call for your specific needs, hop on a call with me, set that up. But, some people have asked me, do I have to pay for this class? Are you selling something at this class? Nope, it's a free class. I'm not selling anything in it. At the end, I talk about if you want to find out what is going on with your specific case, we can hop on a free clarity call. It's about half an hour long. Previously, I was saying they were 45 minutes. I was incorrect in that. They're closer to half an hour long and they're free. So again, tomorrow, 1 p.m. Pacific, 4 p.m. Eastern. I'd love to see you guys join. Sign up at the link that I have shared in the group. If you can't find the link, comment on this and I will share the link directly with you. So I hope to see you guys there tomorrow. Today, we are starting our 4 steps to pain relief, to feeling better, 4 steps to feeling better, really. And today is talking about finding your pain relief modality. So what I mean by this is this pain relief modality is something that you can do or use when you have a flare-up, when you feel awful. What can I do right now? So I will preface this by saying I have a background in physical therapy, personal training, and nutrition. I cannot tell you to take medications. I can tell you about medications, the differences between medications. So in this video, I won't tell you to take medications. I can't do that. I can tell you that there are pain medications that can help with pain and can help with inflammation. If you would like to learn more about those, I have a video from last week of talking about differences between pills and supplements that help with pain and inflammation, or talk to your physician about what type of pill pain medication you can take for yourself. So because I legally can't tell you to take a medication, I will not talk about those in this grouping. Just know that there are medications that do exist. Okay, so finding your pain relief modality apart from pills and injections. So many of these you've probably been told you should try. Ice, heat, taking a hot bath, especially an Epsom salt bath, getting a massage or doing self-massage, going to a chiropractor, using a massage gun. So those are the 6 things that I'm going to talk about today. So ice and heat in the beginning. I'm going to talk about those 2 kind of together and a little bit separate. So you've probably heard about ice and heat a lot. Why should you use them for pain relief and who do they help? So ice helps calm down pain, inflammation from a hot, swollen joint. If it feels hot, put something cold on it. Okay? If it feels hot, you don't necessarily want to put something hot on it. There are a few cases where you would. So ice for a flare-up should be done for at least 20 minutes at a time. And when you're in an active flare-up, I actually recommend you do ice every hour that you're awake. So 20 minutes on, and then you're probably doing it 40 minutes off. And in those 40 minutes, it can be in the freezer getting cold again. You can use a bag of ice cubes. You can put that directly on your skin if you can tolerate it. You can use a gel cold pack that you can buy from Amazon. Bed Bath & Beyond has a bunch. That kind you would want to put in a pillowcase because the gel can get too cold and it can give you an ice burn. Ice cubes will melt before that happens. A gel pack will not. So, but just to be on the safe side for everything, just put it in a pillowcase. You don't have to put it in a thick towel, and I actually don't recommend using a thick towel. Just use a pillowcase that's thick enough. Okay, so ice for 20 minutes at a time. When you're in an active flare, you should be doing it every hour you're awake. And I recommend for 7 days when you're in that active flare. So you're icing a lot. So that could hinder what you're doing throughout the day. If you can't ice every hour, ice as much as you can, but you want to ice as much as you can. If you're finding that the body part that's aching or hurting too much is too wide of an area to use an ice pack, you can sit in an ice bath. You only need to do that for 3 minutes because it gets so cold so quick, but it's usually not tolerable. So I usually don't talk about it too much. It's really, really uncomfortable to sit in an ice bath. So I do recommend a bag of ice cubes or one of those gel packs. So 20 minutes every hour you're awake for 7 days. Heat is the same kind of thing. When you're in an active flare and heat feels better for you and helps your pain better than ice does, you want to do it for 20 minutes every hour you're awake for 7 days. So that's when you're in an active flare. So who should use heat versus ice? If you don't tolerate ice, don't use ice. If you don't tolerate heat, don't use heat. So I don't tolerate ice too well. It just doesn't feel good. So I tend to use heat. I use an electric heating pad, or I use one of those. They're filled with beads. They're called Bed Buddies is one of the brand names, where it has beads or rice in it. You can put it in the microwave. Usually has a lavender scent to it or a cinnamon scent to it to help calm you down. And you use those for 20 minutes at a time, every hour you're awake for 7 days when you're in an active flare. Even if, let's say you do ice or heat for 5 days and you feel good on that 5th day, if you've recently had a flare up, just do it for another 2 days. Get that pain and that inflammation to really be calmed down. It's kind of like when your doctor says to take those antibiotics, don't stop the pills early, even though you feel better. You need to kick everything out. Same kind of thing, not as dramatic, but I find that just do it those extra 2 days to really feel good. So that's ice and heat. If you're having a problem like bursitis, where you have an inflammation, maybe it's a hip bursitis, a trochanteric bursitis, or prepatellar bursitis on your knee, I actually find that heat immediately followed by ice, 20 minutes heat, 20 minutes ice, works really, really, really well for a bursitis flare-up. So 20 minutes heat, 20 minutes ice, and do that as often as you can. Ideally, every hour you're awake when you're in a flare-up, but life gets in the way, do it just as much as you can. Okay, so that's heat and ice. Hot bath, hot Epsom salt bath. I really like hot Epsom salt baths when I have a spasmed muscle or a really big cramp, especially in my hip or my back or my thighs, where the area that's being irritated is large. So getting in that hot Epsom salt bath for 20 to 30 minutes, you can do it longer if you want, helps calm down the spasm, helps relieve the pain and the tension. When you're in a flare-up, I do recommend doing that hot bath for, again, about a week. You only need to do 1 a day. So I recommend at the end of the day, using some lavender oil to help calm things down, or using your doTERRA deep blue oil to help with that pain relief. In 20 to 30 minutes in that hot bath. I like adding Epsom salts. Honestly, I don't know how they work, but when I have muscle soreness, and I take a hot bath versus a hot Epsom salt bath, the Epsom salt bath makes me feel a lot better a lot sooner. So that's why I recommend Epsom salt baths. I buy Dr. Teal's from Amazon. It comes in just the plain regular unscented. You can also get lavender or spearmint or eucalyptus. I'm sure there are other scents, but that hot Epsom salt bath really works well for spasmed muscles or muscle cramps that just won't release. Next one we'll talk about is getting a massage. So you can go and get a professional massage from a massage therapist. I really like that when I feel really tight, not necessarily in pain, but feels like, you know, I just can't move as well as I want to. It's like my hip doesn't go as far as it could last week. It just feels tighter. So that's one reason I like massages. Or if I have a spasm in my back, or like a sciatica type symptom in my butt or in my leg, going to the massage therapist, have them work out the whole area, not just the spot that you have pain, because the spot that you have pain might not be where the spasm is originating from. So let's say it's sciatica with pain going down the whole leg. The sciatic nerve gets pinched at your butt. So you want to make sure that you're massaging out the area near the butt, not just in your calf or wherever you're feeling the pain. So I like massages 60 minutes up to 90 minutes, depending on how long you can tolerate laying down. And when you're in an active flare, I recommend one massage every week for a month. So that's 4 massages in the month. That's when you're in an active flare, to really just get those muscles to calm down, get you to be feeling better. I also recommend drinking lots and lots of water after the massage. So an extra 2 glasses of water immediately after the massage, and then using heat later in the day after the massage, because you've stirred things up, you've warmed things up, and you want to keep that going to help make those muscles calm down so that they don't feel so spasmed. Okay, so that's massage. That's 1 a week for 60 minutes, 4 weeks in a row when you're in an active flare-up. And then there's also the chiropractor. I like the chiropractor for when you have a tight joint, or when you get this sharp, shooty pain in your back or in your neck when you twist or turn, or if you feel like you're kind of turning all in one block. That's when I like the chiropractor. 2 years ago, I woke up in the morning and I couldn't move my neck without incredible pain. And so I booked an appointment with the chiropractor that morning. I don't actually see a chiropractor regularly. I just find that I can keep things at bay without having to go. Some people do need to go regularly, but in this one specific instance, I felt like, oh my gosh, there's nothing I can do. My stretches aren't working. My massage gun didn't work. Heat didn't work. I need to get to the chiropractor. So I got to the chiropractor. They did their little maneuver, and then I added some heat to it that day and did a few gentle motions and exercises, laying down so that my neck could feel the relief. And so those are the kinds of things that I recommend the chiropractor for. There are other reasons. I personally haven't experienced them, but if you find that the chiropractor helps relieve your flares, do what works. Just know that you also need to do a few things at home. So doing a few motions that they may show you, or your physical therapist or personal trainer show you, using some heat to further calm things down, bring the blood flow to the area for the healing process. So for the chiropractor, I only needed to go that one time, and then my exercises, strength and stretching, and the heat worked for me after that one visit. Had I woken up the next day and it still felt similar, maybe a little bit better, but similar, I would have gone again. And so you kind of play it by ear with the chiropractor. If you're feeling better, but not quite back to your normal, go again and keep monitoring it over the next week. Okay. And then the last thing I want to talk about is a massage gun at home. So you might have seen a brand called Theragun. The brand I use is called Booster. They all do the same thing. Theragun has a patented way of the handle design so that you can hold it more comfortably. I use the massage gun to help spasmed muscles, tight muscles, sore muscles. I use it to prevent soreness and tightness from coming on after I've gone for my walk. So I do my stretches after my walk, and then I use my massage gun about 30 seconds on each spot to help prevent the soreness from kicking in. I use it a little bit longer, maybe a minute at each spot total, if I have an active spasm. And if I have an active spasm, I'll use that massage gun 3 times a day on the spasmed area and the surrounding area around it. And I'll do that daily. So 30 seconds to a minute per spot, 3 times a day for a whole week when I'm in an active muscle spasm, cramp, something that's just not letting go. A good example is like a Charlie horse in my calf at night. If I'm noticing I'm getting that, I will use my massage gun before I go to bed, first thing when I wake up, and then sometime in the middle of the day. So that's my 3 times a day when I'm getting the Charlie horse cramps when I'm sleeping and I have to, I wake up and feel it. I don't do it immediately when I first wake up. Excuse me. I don't do it immediately in the middle of the night when I wake up with the Charlie horse. I actually just plant my foot flat on the ground and lean some pressure into it. That really helps. I found that I can't even get into the position to calm down the Charlie horse while it's happening. So I use the massage gun, not when it's actively happening in the moment, but I'll use it before bed and then first thing in the morning and then sometime in the middle of the day. So if last night I got a Charlie horse, I would use the massage gun first thing when I woke up today, in the middle of the day, and then before I go to bed tonight, and I'll do that for the next week. Okay. And then I would actually also use some heat and a hot bath on a Charlie horse. So those are my recommendations for things that you can do at home that I can tell you to do. So we talked about, I can't tell you to take pills or medications. That is not in my scope of practice. I can talk about what the different ones do, how much you need to take for an inflammatory reaction versus a pain reaction, but I can't tell you, yep, go and take this one pill. So that's why I did not talk about that today. So I talked about ice, heat, hot baths, massage, the chiropractor, and using a massage gun yourself. So those are some steps to take to find your pain relief modality for when you're in an active flare. And I invite you to join me tomorrow for my hour-long masterclass, Why You're in Pain, What's Getting in Your Way, and What to Do About It, 1 p.m. Pacific, 4 p.m. Eastern. Click the link to save your spot. I will see you there, and I will talk to you guys soon here in the Facebook group.